Welcome to Progressive Soup. Welcome back. We're continuing our discussion with myself, David Stevenson, Gene Hislop, my co-host, and John Hartwell, who represents NARAL, Pro-Choice Connecticut. He's the acting executive director. And off camera, we were talking a little bit about, Gene and I, as everyone who watches the show knows, are very big with immigration rights and immigration, taking care of our next generation of Americans. And both of us, of course, are our families are relatively new here to the United States. I'm third generation Irish American, and
you're on one side of the family.
One side, exactly. Well, the other side goes back to the Mayflower, but I don't talk to that side of the family. They're too far removed from me. But the idea of carrying that over into the idea of men getting involved in what is traditionally a woman's issue and a woman's movement. Take us there. Talk us into that. Bring us into that idea of getting men involved and how men have gotten involved and what draws men into the issue here.
How about why should men care, to simplify it?
That's good. I like that. Why should men care about a woman's issue?
Well, if it's classed strictly as a woman's issue, then men probably won't care so much. But if it's classed as a human rights issue, and if it's classed as an issue about the people that they care about, then they're going to more likely be involved. So clearly, obviously, biologically, men can't get pregnant. So reproductive health services that directly affect pregnancy and carrying a child to term are not going to be men's issues.
Yeah.
If we talk about sex ed in the schools, for example, that's an equal rights issue there. I mean, that's equally men and women, boys and girls. And I know that when my children were going through school, I wanted them to be completely aware, both my son and my daughter, of what the ramifications were of having sex and how you should approach it, and the whole range of issues that are around human sexuality, because when you're a teenager, that's what you're most concerned about, and the issues are difficult. So that's not a woman's issue, and that's something, however, that we at NARAL are very concerned about, is making sure that there is adequate, medically accurate sex education in our schools.
Likewise, both of us, having had grown children now, wanted our kids to grow up and get the lessons, not just in the home, but also in the school, to help them become responsible adults.
You want everybody
to make responsible
to have
choices. Yeah,
that's right. To make responsible choices. I've got a daughter. If she's engaged in sexual activity, I want to make sure that she's safe. I certainly don't want her to have an unintended pregnancy. But if something happens, if contraception fails, and the statistics on the failure of contraception are pretty stunning, actually. Contraception is not 100%. There isn't any method of contraceptive, any one method of contraception which is 100% accurate. And so people do get pregnant even when they don't expect to, and sometimes when they don't want to, in fact, when it may be the worst thing in the world for them.
And when they're taking steps to prevent it.
Yes, so you can be taking contraception, you can be very conscientious about that, and you can still get pregnant. It happens. And for some people, it can be a disaster. So in those situations, obviously, as a parent, I want my child to have the full range of choices available, so that if she decides to carry the child to term, we support that. If she decides to terminate the pregnancy, we support that. We want to make sure that if either of those decisions is made with good medical advice, and that whatever happens, that she has the health care that she needs to remain healthy and happy.
So it sounds like NARAL and, say, Planned Parenthood share kind of the same vision.
Yes.
How do they differ?
Well, it's a good question. Planned Parenthood actually provides medical services primarily to women of color, women in lower economic strata. Not always. There are plenty of middle-class women who go to Planned Parenthood, sometimes because they don't want their own doctor to know what they're doing, much less their family, which is not a good situation, not something that we encourage. But you have to have a variety of channels here to provide health care. There's not one size that fits all. There's not one way to do any of this. So Planned Parenthood has clinics. I can't remember how many they have actually here in Connecticut, but they have a substantial clinical presence. So they have bricks and mortar and doctors and nurses and technicians and the whole range of healthcare services at their disposal. And most of those services are simply services like contraception, like sexually transmitted disease prevention, counseling for various things, and they also provide abortions. It's a very small piece of what they do. NARAL, on the other hand, has none of that.
Right.
We are only policy and politics. So, as I said in the last show that we taped, there are three pieces of NARAL. There is a foundation, a 501c3, where if someone gives us money, they get to take a tax deduction for it, and we use that money strictly for policy development, for research, and for education. That's what the foundation does, and we call that group the Reproductive Health and Rights Foundation of Connecticut. We also have a second organization, which is a political nonprofit. If you make a donation to that, it's like donating to a political candidate. You have no tax deduction for you
free will.
As an individual. You're giving them money. So we use that money to lobby in Hartford, and sometimes at the city level, if there were something going on in a particular city we wanted to address. And then the third arm that we have is a political action committee, which actually endorses candidates and works on elections here again at the state level, not at the national level. Now there is also a similar set of groups at the national level, NARAL Pro-Choice America, and they have a foundation, and they have a 501c4, and they have a PAC.
Now, while you're representing NARAL and Planned Parenthood obviously have a symbiotic relationship to some degree. You probably gather a lot of your statistics from them, I would say, and lobby for them, obviously. Do they have their own PAC that you're aware of?
I don't believe they have a PAC. They have a 501c4, and quite frankly, the rules are changing as we speak because of Citizens United. And so the scope of these organizations is somewhat in question, but ever expanding. So I, in fact, was just talking with one of the senior people in Planned Parenthood a couple of weeks ago about this issue. And from their point of view, there's not a lot that we do that they can't do politically. So they're becoming much more active. And it's clear that they need to be active. The threat is real. So we don't lobby for them. We lobby in conjunction with them. We share a lot of the same, perhaps all of the same goals and aspirations, but their organization provides those services. We don't.
There are a lot of grassroots type of events where we get together and support causes and beliefs that we hold dear to our hearts. Is NARAL involved in those type of grassroots? Do they have a presence at grassroots types events?
Sure. I mean, we create some of our own events, and I think we talked before about the Pro-Choice Men Make Brunch, which are fundraisers, but they're more than fundraisers. They're an opportunity for the members to meet and talk with some of the most important political people in the state. So Governor Malloy is a regular participant in the Pro-Choice Men Make Brunch event. He has been since he was a mayor in Stamford. Senator Blumenthal, formerly Attorney General Blumenthal, is there all the time. At the last one we just had, Well, neither Jim Himes nor Chris Murphy could come because both of them were out of the country when we had the event, but they're both strong supporters. So, I mean, we have the top echelon of the political leadership in the state who come to those events, and people who are our members can meet them, talk with them, become friends with them, exchange views with them. So those are fundraising events. We also do coffees in people's homes to discuss the issues. So those are events, and we send people out to various groups to talk. And then sometimes we have some issues that we organize around. For example, we're very concerned about what are called crisis pregnancy centers. And crisis pregnancy centers look like clinics that Planned Parenthood or other reproductive health providers would have, except that they don't provide these same services. So you might see a sign on a bus saying "pregnant, need help," with a number to call. Well, often that's for a pregnancy crisis center, which is run by a group of people who don't want you to have an abortion, who, when you come in, they don't give you all of the options. They just try to push you toward one solution. And if that's a solution that's good for you, that's fine. The point here is not to push people into having an abortion to terminate a pregnancy. It's to make sure that they have all of the choices available to them that are medically responsible for their situation. So the crisis pregnancy centers have blossomed. They often position themselves literally physically across the street from a healthcare center that provides abortions, and they try to lure people in. So we're concerned about that. We're beginning to organize against these people to at least let people know that that this is not a full service operation, that this is a group that has a political agenda, and that agenda is an anti-choice agenda.
Do they provide a service for women in crisis other than, kind of foisting their own agenda on them? Is there any concrete service that they provide to young girls who find themselves in a crisis pregnancy that you're aware of?
Depends on how you define the word service, but it's all done with a specific outcome in mind, and so throughout whatever they do, the push is toward a certain outcome.
Now, Planned Parenthood on the other side, obviously you're not with Planned Parenthood,
right.
But Planned Parenthood, when you go in to speak with them, I'm under the assumption that they present you with all the options.
Sure.
Okay. So is there any organization that actually, obviously I know if you go into Planned Parenthood, you're in a crisis pregnancy, and you decide to terminate the pregnancy, they will help you. They will, sometimes depending on whether they've got a clinic there, actually perform it. They'll provide counseling for you, etc. Is there a specific organization that would provide you with assistance should you decide to keep the child that you're aware of in Connecticut? Are there organizations that not only advocate, I'm trying to give a balance to you, not only advocate for pro-life, for a decision to keep the child, but then actually follow through and provide services for that? Because it very much is a woman's choice.
After the child is born is what you're speaking of?
Yeah.
People that actually, care about
besides
babies
Department of Social Services
after
and stuff
they're
like
born?
That. Yeah, like...
Well, I think that it would be one of a myriad of nonprofits that are out there, some of whom work directly for the Department of Social Services, others that don't. But there are groups out there that will help you, and depending at the end, let's say that you carry the baby to term and you have the baby, and then the next question is, did you want to keep the baby? Do you want to put it up for adoption? Is it going to end up in a foster home? Those services are, I'm pretty sure, beyond anything that Planned Parenthood does, and certainly is to say we don't provide services to individual patients. We don't have patients at all.
Right.
So it's a bit outside my level of involvement.
What I'm trying to understand is when you had said, these crisis pregnancy centers don't necessarily have actual services. It's more of just trying to push you into making the decision.
Right.
And then I guess what was unsaid is then leaving you to deal
And my understanding is that once you reach a point where you can no longer legally have an abortion after 23 weeks, that you often get dropped. You're on your own.
They've accomplished their goal.
They've accomplished their goal, right.
So while Planned Parenthood will take you through the steps, give you the options, and then help you through the process of making your decision, if your decision is to terminate, it doesn't seem like there's a balanced, like an opposite group that does the same if you decided to keep the child.
It's possible that they do. I'm not aware of it. So, a little bit outside certainly anything that I've experienced.
Well, this is certainly an ongoing dialogue, and it's gone on for many, many years, and it'll continue on for many, many years. And we've had people on the show that take the position that that if a woman becomes pregnant, she should have the baby, she should carry it to term. And we've had discussions about that, and there are terms and there are words that it seems that folks that are anti-choice have stolen away from us, as it should, I think, rightly belong to us. Terms like pro-life. We're pro-life. Consider yourself pro-life? We're very, very much in favor of life. Because obviously the opposite of pro-life would be pro-death.
Right.
And I don't see anybody, and nobody I know is pro-death.
I think George Carlin handled that very well.
Probably so, yeah.
Well, the other day I was talking to someone on the other side, and they said, you're pro-abortion. No, I'm not. I mean, how many women do you know who have ever gotten pregnant in order to have an abortion?
It's
Right.
not something that's taken lightly either. It's not a decision.
How many times would a woman open the paper and say, "Oh dear, look, they're having a special on abortions. Let's go have one."
Yeah, no.
That's not happening.
No, there's a huge misconception. I mean, I do hear it, constantly still. Oh, there's a lot of women who use abortion as birth control. That is impossible. There's no
crazy.
way that, you could be utilizing it that frequently. I mean, that's just insane. It's not a decision you make that quickly
No.
and that easily.
But in fact, I'm told that around 40% of the women in this country will have an abortion at some time in their life. And that is a very high number.
It is.
And it's not something that I find comforting. I would prefer that number to be much, much, much lower.
Right.
And I would love to work with the anti-choice side, the so-called pro-life side, on effective ways of preventing unwanted pregnancies to begin with.
Well, a lot of it's economics, and that's borne out by the fact that during the Clinton administration, Bill and Hillary Clinton were clearly pro-choice.
Sure.
Abortions were down. Economy up, abortions down. During the Bush administration, clearly not pro-choice, although his wife is, in a quiet sense. Economy down, and abortions were up. So I think that's pretty fair indication that it's economics which determines. These are not decisions that are made in a frivolous way by women. They do not.
I'd say also, in addition to economics, and I think the economics part of it is a pretty strong factor, but if you have the federal government and many state governments actively telling young people that the way to not get pregnant is to not have sex, and not telling them about what they can do if they make the decision to have sex but don't want to get pregnant, your pregnancy rate's going to go up.
Yeah, that's asking for trouble.
Well, not only economic, as in the way of people can't afford to have children, they're laid out, they're on unemployment. But what people fail to understand is also during this economic crisis, we've seen massive budget cuts. So not only, nonprofits have had to tighten their belt, so agencies that would help with, formula and stuff for your children are now having a more difficult time doing it. Social services is being cut too.
Well, let's talk about access to contraceptives. The pill is not cheap.
Right.
And in order to get contraceptives, you have to go to a doctor.
Yeah.
And if you don't have regular access to doctors, and you don't have the money to pay for the pills, and then again, on top of it, you may have the situation where you're working 2 jobs and your life is very stressed, and these things require a very regular, repeated dosage in order to work. I mean, all of these things are factors. Who knows which one is the most important? But they're all factors. And then again, as we spoke about in the last program, even if you do everything you're supposed to do, it's still possible to get pregnant. There is no method of contraception which is 100%. So what happens then? And there's one of my friends says, well, the woman chose to have sex. What does that mean?
Yeah, well, didn't the man too?
Didn't the man too? Right.
That's right. It throws a responsibility right back on the woman, which is
well, and not to
certainly
mention,
not
there's a certain
fair.
Percentage of women who aren't choosing to.
Well, exactly. Yeah. Actually, there's rape, there's incest, there's there's accidents. So, to take a black and white view and to say, well, she's pregnant, that's a child, abortion is murder, can't have it. I'm sorry, I can't go there.
It's not looking at the world in a realistic way, and it was noted not too many years ago that the woman who was the litigant in Roe v. Wade had changed her mind and then come around to being, as she called it, pro-life, anti-choice, as if, and the feeling that I got from that she made it sound like women, as we talked about earlier, women just make a decision willy-nilly or without a lot of anguish and a lot of thought and a lot of contemplation to have an abortion. Yeah. It's not something that's entered into lightly by any woman.
And as a woman, I don't want to say that there are not some women who will find themselves in that situation, make that choice without ever a second glance. I think those
are few and far
rare,
between.
But it is extremely rare.
Well, there are axe murderers in the world too, but I think that the women take a lot of time in making these decisions. It's a very well thought out, a very agonizing decision for a woman to make.
It's not only an emotionally agonizing thing to do. It has possible ramifications to our health too. I mean, there are, even as safe as abortions are these days, and compared to back alley abortions, there are still situations where a woman can find herself infertile after an abortion because something happened.
Anytime you have a surgical procedure done, the risks run from mild infections to death.
So it's a decision that is made realizing that not only are you going through a painful, physically procedure, that you're going through a procedure that might have, effects in your future, but it's also an emotional, deeply concerning decision, which is why it needs to be handled with a healthcare professional, and a reason why there needs to be some counseling, some emotionally supportive counseling as well.
Point well taken. What John said earlier about it being not a simple issue. It's a very complex issue, and the more folks you have involved, hopefully family members are going to be involved in supporting the woman who's ultimately the one that needs to make the decision. Society makes her be the one that ultimately makes the decision. But there needs to be support services to help her think through the whole process and make the decision that hopefully is the right decision for her, for the husband, for the other children in the family, for the entire family, and for society at large.
As a Unitarian Universalist, I'm actually a member of the Unitarian Universalist Church. I received their monthly magazine, UU World, and a couple of issues ago there was a great article about one of, I believe it was in Phoenix, a Unitarian Universalist church decided to start up their own 24-hour hotline for people who had either gone through an abortion or were considering going through an abortion, and it was just to listen. That was the objection. The objective of the 24-hour hotline is just, we're there to listen to your emotions, because unfortunately there's there's counseling you can go in beforehand. If you go to Planned Parenthood, they'll talk about your options, and they'll, listen to what you're facing and what might be making you make that decision, etc. But there's not a lot of follow-up afterwards, as far as counseling to deal with the emotions surrounding it. And there's a real need for that, a real need for that in our world. When you're so bombarded with the messages on television, even when you're getting into a political debate and when you're hearing news reports, you're hearing guys say, or in some cases women say, women shouldn't be able to use that as a method of birth control, that it is murder. It's something you're going to hear over and over again in your life after you've had an abortion.
It's like an advertisement. It's simple, it's repeated, and eventually a lot of people will just accept it because they've heard it so many times.
And it's incredibly painful every single time you hear it. It re-stimulates the, the decision that you made.
Look, the money in this country is behind things like Cialis and Viagra.
Which are generally covered by medical insurance.
Right.
But birth control is not generally.
And are explicitly there to promote male sexuality. Well, most men have sex with women, and who gets pregnant?
Yes.
So the medical this is not a medical thing here. This is actually an economic, corporate thing, where the money has flowed into the drugs that are there to increase male sexuality, and the results. Nobody cares about the results. The women are left with Planned Parenthood to be, have the funding cut.
Yes, that is quite the problem. We have a very, as a feminist, we have a society which promotes the idea that the idea of a normal man is a man who's, a ladies' man, and he's going out and he's having sex with a lot of women.
He's ready to go.
Yeah, he's ready to go. And meanwhile, it doesn't talk about the very realistic aspect that women have to go through.
Again, a very simplistic way of looking at life. But life is not simplistic. Life is not simple. Life is complex. And our discussions on abortion and choice should not be a yakety-yak back and forth of slogans. It should be a good, clear, honest discussion that should mostly be focused on support and love. Thank you. This is Progressive Soup. We've run over. David Stevenson, Gene Hislop, co-host. John Hartwell, our guest. Thank you very much. Good to have you back.
Thank you.